Good afternoon. Good afternoon. Buenas tardes. That word? Okay, we are going to start our afternoon session with a great talk. And Dr. Ariana Johnson is going to share some of the work that we are doing with Photovoice. And actually, it's great that they scheduled this talk after my talk because this is a continuation of what I presented. Um, so Dr. Ariana Johnson is an assistant professor in the Department of Public Health Science, the Division of Prevention Science and Community Health. She is an epidemiologist, and her research focuses on implementation science, social network, AI, machine learning, health disparities, HIV prevention. As you may, so I am her mentor, so that everything Ariana. So I don't need to read a lot of this. Okay. Currently, Dr. Johnson examined how syndemic factors among sexual minority men influence the adoption of HIV prevention behaviors. But Dr. Johnson has been involved in several projects that incorporate photo voice as well as implementation science. So that is what she's going to present today. And the title of her talk is Using Photo Voice in Implementation Science Project, Lessons Learned and Next Step in Equitable Research Practice. Thank you, Dr.
And I was supposed to be presenting today with Kyle Self, but he unfortunately came down with some illness and is not able to be here today. And I know I'm presenting in the afternoon, which can be kind of a slump after everyone's had some food and some cookies. So hopefully you got some coffee too, but I'll try to do my best. And if at any point anyone needs like a stretch break, just like raise your hands up and we can take a moment so we can also have that. But I'm really excited to be here today, and I'm excited to be talking about both photo voice and implementation science. I think I'm talking to a room of absolute experts. So some of this might sound redundant for some of you, but hopefully there's something more that we can talk about here and talk about the work in practice. So a bit of an overview about what I'm going to discuss is defining what is photo voice, really asking about people's experiences using photo voice, talking about photo voice and incorporating implementation science, giving an example of photo voice in practice with a study that has already been completed, and then talking about some adaptations and lessons learned from that first project and how we've then tailored the training of the team and our next steps in the implementation of photo voice in a second project that is also including photo voice and implementation science. So what is photo voice? Do we have, by a show of hands, who has used photo voice in practice? I have some like tentative hands, but I take that as having used photo voice in practice. So much of this might sound like definitions that you're familiar with, but hopefully the way in which we've incorporated implementation science will be something a bit different. And if I pick on you for your photo voice knowledge, please don't be. Okay. So just defining photo voice. Photo voice is a process in which people use video and or photo images to capture aspects of their environment and experiences and share them with others. I think it's, something that's very well known is a photo is worth 1,000 words, right? A photo can capture 1,000 words. And so the pictures are then used with captions created by the end user and decided on by the participant to bring the realities of the photographer's lives to the public, academia, and or policymakers, really with the ultimate goal to provide a platform to increase equity. So photos don't require literacy, only a camera from either a cell phone and conversation. So in that way, I know that the topic of this entire week-long seminar is equity. So I also want to talk about how Photovoice increases equity in community-based participatory research. And Photovoice as a concept has existed for many years, with one of the most known studies and kind of the beginning of Photovoice being attributed to a study done in 1997 by Wang and Burris. And Photovoice was developed based on a combination of the notion of critical consciousness, feminist theory, and documentary photography. And the first known, or this pivotal beginning of Photovoice, was when Wang and Burris gave cameras to a group of rural village women in the Yunnan province in China, who then were asked to document their lives and their environment for the entirety of 1 year. And at the end of the project, the group then hosted an exhibition of their photographs and used it to raise the consciousness of policymakers about the public and the public about their needs. The women at the end of this 12 months reported feeling they gained not only a voice, but greater self-respect and a sense of increased control over their lives. And the women gathered at regular intervals across this 1 year period to view and discuss the pictures that they had taken. The key concept, as is defined by Photovoice, is that images teach, that pictures can influence policy, that community members ought to participate in creating and defining the images that shape healthful public policy. The process requires that from the outset, planners bring policymakers and other influential people to the table to serve as the end audience. And Photovoice emphasizes individual and community action, with the primary goals to help those who are often unheard gain a voice, to enable them to record and reflect on their experiences and their community's condition. And this can be both positive or negative. And to encourage critical consciousness. Through choosing, discussing, and reflecting on subjects of their photographs, the photographers can come to a clearer understanding of their circumstances and the economic, social, psychological, and political forces that shape them. And again, with the primary goal of bringing about change that will improve these conditions and enhance lives by reaching and influencing policymakers. But wait, why not just do focus groups or semi-structured interviews? Does anyone have an answer or a thought? Yeah.
There may be literacy challenges, and then depending on the dynamic, you may not want to do focus groups because it may not be safe.
Right.
In some instances.
Absolutely. Any other thoughts? Yeah. Right. Right. Yeah. Mm. Right. Yes. Right. Right. And I think a big conversation that was had in deciding to move forward with Photovoice was who generates the questions and who gets to direct the conversation. Photos are putting this back in the hands of the participants. And the idea is, as researchers, to be able to be as hands-off and be able to allow that conversation to really develop in a way that we might have thought we thought through everything in creating the semi-structured interview guide, but now participants are really able to have this huge breadth of what they can bring up in that Photovoice process. So again, in a fun little activity, I have here a photo and I have a prompt here that says experiences and perspectives of individuals during the COVID-19 pandemic. So I'm going to ask you all, what do you see here? You can shout it out. We don't need to do hands raising, and there's no right or wrong answers. I don't have, yeah. Right. Right. But bringing up personal experiences, a huge recall of a negative experience that you had surrounding the COVID pandemic. Do we have any other knee-jerk reactions of what you see here, thoughts? Impersonal, okay. Expanded access. So we see some barriers, but a potential facilitator here. Then we're seeing that this could be expanded access. Because what about those that don't have a drive-through swab? Hmm. So who is getting access to this testing here? Hmm. Right.
Their potential concern about their own risk.
Hmm. So personal risk and their willingness to put themselves in that position and thinking about not just the person receiving that potential painful swab, but both parties involved. Do we? Hmm. Right. The actual conditions in which this is taking place. So she said living in places that could have winters versus places that have more temperate weather year round and being able to access things that are outside. And then I think we had other comments. Hmm. Right. Right. Yeah.
And then to lead off of what Rochelle said, I'm thinking about the sheer fear,
Hmm.
right? Because in New York City, I was just I had lunch with Renee, and I was like, within the first 3 years of first 3 weeks of the pandemic, in March, New York City was a hotspot.
Hmm.
So within 3 weeks, I personally knew of 30 people who died within 3 weeks. So
Wow.
I'm thinking of the sheer fear
Right.
that whoever is testing must be having, because she has on goggles,
Hmm.
she has on the N95, plus she's got a face mask, she's got her hair covered, plus she has on other protective gear, plus gloves.
Right.
So I'm wondering how much fear the healthcare providers had as they were administering and trying to help save lives.
So really fear on both ends of participation in this. Do we have any other thoughts that we have? Yeah.
Shared responsibility and duty of the citizens to go and seek testing
Hmm.
themselves. These scenarios where they are, I guess, being responsible and conscientious of their surroundings to go get tested.
So individual motivation for being in there. Is this person symptomatic? Is this person just trying to make sure that they're being safe if they had an exposure? Okay, so I just wanted to use this as kind of an example of showing the power of one photo. We had facilitators, we had barriers. You can bring in things of looking at different levels of inner setting. What is outer setting? We can bring about things that would be something you would want to intervene upon, right? We're talking about access. Who has access to these? How could we expand access to testing? What does testing bring about on a personal level? What does it bring about on a more of a citywide level, on a structural level? So I think that this is just a good example of kind of the power of Photovoice. And I know we have many academics here that are probably a little bit more likely to participate when asked about things, but I know that sometimes when you're prompted in a focus group to share your opinions without anything to look at or without anything to kind of be a break the barriers of entry into a conversation, I think it can be a bit intimidating. And so I think that Photovoice is something that can really make it, you're talking about a photo and it could be a photo that you've taken and you're able to kind of break down those fears of being able to have these conversations and have a lot more people engage and then kind of pivot and bounce off of one another. And it can be agreement, it can be disagreement, but that conversation can be incredibly rich. So thank you for participating in that with me. And then again, wanting to bring it back to the overall goal of this entire session. How does Photovoice, how can we look at it through an equity lens? And I think that much of this has already been mentioned when I asked about Photovoice or when I asked about photo taking. And photo taking is an aid in conversation starting. I think we just saw that here. And by giving the community the tools to document and narrate their stories, it's empowering them to express their viewpoints in a nonverbal format. And Photovoice encourages community members to engage actively in identifying problems and then brainstorming solutions. So not just identifying, oh, there's so many negative things happening, but to empower them to also ask, what would you like to see done about this? Which then promotes a more equitable distribution of power within the community. And the visual nature of Photovoice makes complex issues more accessible and understandable to a broader audience. And I think this is something I'm really going to be focusing in on, how we then bridge implementation science and Photovoice. How can we use Photovoice to then help take a language that is implementation science and bring it to a community that we're then trying to get to incorporate their feedback into our project. And this can lead to increased awareness and empathy, promoting action and support from various sectors. So then, as promised, how did we incorporate and why incorporate Photovoice and implementation science? I like to just add in funny implementation science memes because I think it's funny and I always find this funny. And I'm sure many of you have already seen this, but it makes me giggle every time. As of course it reads, the latest research shows that we should really do something with all this research. So why might this be useful? And I'm using terminology here from CIFER constructs as an example of how photos can actually address these different and be mapped to these different CIFER constructs and how they can enhance some implementation science frameworks. So here we have intervention characteristics. Photos can capture how the intervention is perceived in terms of complexity, adaptability, and relative advantage. Discussions can reveal how these perceptions impact implementation. In outer setting, participants could document external influences such as community needs, the environment, and socioeconomic factors that affect implementation. At the inner setting, photos can highlight the organizational culture, readiness for implementation, and available resources within the setting. And at the level of an individual, through their photos and narratives, participants can express their beliefs, knowledge, and attitudes towards the intervention. And in process, they can document the stages of implementation through photos that can provide insight into planning, engaging, executing, and reflecting on the process. So I'm going to walk through a study that has already been done that did incorporate Photovoice and implementation science. It's called the DiversaPrep study as an example. And this is going to be lessons learned and how we then adapted from these lessons learned into the future project. So a bit of an overview of the goals of the DiversaPrep project. Together with community partners at Latino Salud, who you had the pleasure of meeting in the previous presentation, we used Photovoice and a CIFER framework to identify modifiable barriers and facilitators that influence the effectiveness of DiversaSafe, which is the prep service program offered at each of the Latino Salud sites. And they operated at the time at 3 different sites: Miami Beach, Southwest Miami, and Broward County. And to then document best practices for delivering this DiversaSafe prep program, which is a one-stop prep program, to Latino Salud clientele, that being Latino MSM, their non-Latino MSM friends and partners. So our Photovoice in practice, and I think this is very similar to a lot of other Photovoice practices, is it consisted of more than one session. So it was a total of 2 sessions. And prior to session 1, the staff of the team assembled train the trainer materials, met to discuss possible issues and themes to stimulate discussions with the group participants. And once the group participants were recruited, they were asked to participate in these 2 Photovoice sessions. Session 1 was the train the trainer. We trained the participants in the Photovoice methods. They were oriented to the questions being asked, and we reviewed the ethics of photo taking. They were then asked to return 1 to 2 weeks later to share the photos they'd taken over the past 1 to 2 weeks, caption the photos, and as a group, use the showed method to create group captions for these photos. And we should note that this was originally going to be done in person, but was at the height of the pandemic. And the reason it transitioned to being a focus group on Zoom was because of the nature of the change that was required, just because of what was happening in the world at that time. So that was a further adaptation that we hadn't planned on doing, but was just a reaction to how the research needed to pivot at that moment. And then during session 1, participants were introduced to the primary goals of the project. They were introduced to the person who acted as the facilitator, and they were told from the first moment that there was a desire to publish a manuscript with the findings. So they were also made aware of this and asked if they would be okay to receive at the end of it prior to it being submitted for publication, they knew that they would be able to provide feedback and ensure that what they were providing with these photographs and the associated themes were in fact what they had been asking or what they had been saying during those sessions. Participants were then taught the basics of good photography, ethical photography principles, and instructed on the Photovoice assignment. And as we were learning, participants did not feel that they needed to be taught the basics of good photography. And that was something that we've now adapted. They said, we love these slides. It's completely redundant. I've been taking pictures with my phone since I got a phone, and I got a phone 25 years ago, and I'm now a pro. So we then adapted that and said, okay, in future sessions, maybe we can cut out 25 minutes because we don't need to talk to you about how to focus your camera, who needs to be the subject of that photograph. People really felt like they had a handle on that. And we, of course, left it very open if people had any questions about it, but really adapted from their first initial feedback to focus more on the ethical photography principles and the Photovoice assignment itself, and to focus less on how to take photographs. And that is a bit of a step away from the initial Photovoice training in that they do spend quite a bit of time talking about how do you focus this photo, who is the person that you are trying to capture in this, and we just found that the audience didn't feel that it was necessary and kind of took away from the actual goal of the project itself. Participants were then asked to consider the prompts and take photographs independently on their phone in their daily lives that represented their views and experiences related to the prompts for over the course of the next 2 weeks. This is an example of one of the slides that we would show about photography, power, and ethics. So really asking the group while they were there in the train the trainer session, what is my responsibility as a photographer? How can we be respectful, be polite when approaching others, and ensure that we do not invade the private space of others? We ask participants to ensure their safety throughout photo taking. So don't do anything you wouldn't normally do. Don't take a photo while you're driving, even if it could be something that you think best represents what you're trying to capture. And ultimately remember that your picture tells a story, and what do you want to say? And what does it mean to take a picture? And had conversations around privacy, culture, power, and storytelling. And a big part of this was then also in the era of social media, people then say, can I take a screenshot of someone's Instagram? And really having to get into that conversation of, if it is not a public figure, then that is a privacy concern. Maybe that friend that you have on Instagram is not willing to share their information. And that was something that I think that as we're adapting needs to be taken into consideration in a conversation we had with all participants. So in this, we did not allow photos of people with identifiable information, and you were only able to use pictures of people that would be public figures to ensure that all people had privacy throughout. Here's another example of a slide that was shown in that initial session 1. So again, composition, the placement of elements, and really thinking about what's the objective or environment I want to show that needs to change, or what am I hoping to tell a story about? Oops, how do I go back? Okay, I've skipped ahead and I'm terrible at this, so I'm just going to talk through the others. So after session 1, after being asked to take 5 photographs over that course of that 2 weeks between session 1 and session 2, each participant was asked to upload these photos securely to REDCap and anonymously to REDCap, associated with an associated caption. And the facilitator then incorporated the photos into a PowerPoint presentation that would then be shown to the group. However, prior to showing it to the group, each participant was asked individually in a Zoom breakout room if they were comfortable sharing their photos, captions, and opinions, and if not, the facilitator read each caption and showed each associated photo. And I should note that in this, each of the participants were able to remain off video in Zoom, and they were able to have a nickname or a name that was completely unrelated to their name. So anonymity was, if desired, allowed to be preserved throughout this session. And during session 2, that's really where the in-depth discussion of each photo began and was facilitated using the showed method, which is a traditional method of question that has been used in Photovoice that involves discussing the picture literally, identifying how a picture relates to the relevant issue at hand, and developing actions that could be taken to address those issues. The showed questions are based on the letters in the acronym and include, what do you see here? What is really happening? How does this relate to our lives? And why does this problem or strength exist? And how can we be empowered through this new understanding? And what can we do about it? After all of the photos and the discussion has taken place, participants then voted on the top 5 photos of all of the photos collectively that they felt best captured the barriers and facilitators to PrEP services they had identified. Then, once the group had reached consensus, the team developed a list of barriers and facilitators, that is, themes, and asking the group, can we talk about words that you would have to describe these photos that you would attribute as barriers or facilitators to PrEP services? And then use this list to guide the discussions on how each theme applied to both Latino and non-Latino MSM communities. These final lists of themes were provided to the research teams for further analysis. And the analysis did include triangulation approaches used to compare the list of themes and issues identified by participants, both across Latino Salud sites and across subpopulations. So it should be noted that each group did identify as a different subpopulation. You had one group of Latino MSM, one group of non-Latino MSM, and we were able to compare those themes across both sites and subpopulation. And content analysis with deductive approach was utilized similar to that found in the Damschroeder and Lowry paper. So although different methodologies, we then utilized content analysis similarly. And this was done alongside and with the help of master's students who assisted with the content analysis. And our analysis took place over 4 phases. In phase 1, descriptive observational field notes, the showed captions, and the themes that were provided, that list that I just discussed, that were provided by participants, were used by the research team to create preliminary subcategories. In phase 2, preliminary subcategories and the transcribed text from the interviews were analyzed using qualitative content analysis to describe what was perceived as a barrier and what was perceived as a facilitator. And the description and text provided by the participants remained as close to the spoken and written text as possible. In phase 3, the research team reviewed the relationships among subcategories across focus groups and combined related subcategories into broader categories, which resulted in the creation of central themes. Findings from the existing literature and CIFER domains were then used to review and refine central themes. And the final set of central themes, the CIFER domains that these themes related to, and the corresponding caption photos constituted our preliminary findings. And in phase 4, as I mentioned before, these sets of themes, caption photographs were then sent back to each participant to ensure that the description and context appropriately represented what they had discussed. Any suggested changes from the participants were then incorporated into the final list of coded themes, and that was what was included in the manuscript submission. Here's just an example taken from the Damschroeder paper of the triangulation approach, with independent reviewers coding separately to give each CIFER construct a score of -1 to +2, and scores for each interview's constructs were compared between coders, and once consensus was achieved for all individual construct scores for each interview, an outside auditor who was a qualitative expert that was not integrally involved in the study then reviewed all codes to provide a neutral check that they accurately reflected the data presented and the quotes supporting the findings. So what were our results? The following 5 central themes emerged around barriers and facilitators to PrEP service for Latino and non-Latino MSM in South Florida. 1, the need for normalizing PrEP messages within the MSM community. 2, the need for normalizing PrEP messages outside of the MSM community. 3, the need for expanding PrEP knowledge overall. 4, different motivations for using PrEP among subpopulations. 5, the presence of structural barriers that limit PrEP access. These themes, their associated images, and captions were chosen directly by the participants. So here is an example of the photo that was voted on by the group as being most representative of a barrier to prep services, and the associated theme of normalizing prep messages within the MSM community. And the group caption that was created reads, individuals in the community may not know their status because they do not hook up or engage in sex with random people. And because of this, they do not get tested or take PrEP. And as you can see, the associated photo reads, what's your status? Oh, baby, you don't have to worry. I rarely hook up. The next picture we see here is an advertisement for free online PrEP next to what looks like a trash can and a newspaper, an area where you can get a newspaper. And the theme here is normalizing PrEP messages outside the MSM community. And the collective caption that was voted upon and come up with collaboratively reads, PrEP, a double-edged sword, just like this image. On one hand, it attracts the attention of gay men by using a shirtless man in a gayborhood next to a bus stop, so it makes sense that it is targeted and that it is easily visible. On the other hand, it calls attention to sex and lust by only gay men, sending the message that this is a drug for gay men only because of our sexual activity compared to other demographics. Here we have the theme of the need for expanding PrEP knowledge, and you see a variety of what looks like cluttered paper and messages. And the voted on caption reads, overwhelming, like the paperwork and bureaucracy to be able to get PrEP services. It also makes me think of information overload. And here we have themed different motivations for using PrEP. And we have the collective caption that reads, we still see how religion points at us and judges us, but at the same time recognizes and includes us. This is something very positive in the community because it also invites us to take care of each other. And Latino participants particularly describe religion as exclusionary yet embracing, judgmental yet unconditional. And the above quote in this specific group alludes to religion imposing judgment of non-normative sexuality while still embracing and encouraging them to care for themselves and others. And the last theme was structural influences, including transportation, time, and money. And the picture we see here is of a bus stop in what looks like Miami-Dade County. And the associated caption is, I believe transportation is a factor in how we can find a way to get help. Unfortunately, it is not easy, especially knowing Miami weather. It makes it super inconvenient to find public transportation. Also, knowing that it's not as convenient and may not take you to places near you at a short time period, places can be far away and may require more than one bus. So these results of this is not using CFR 2.0, of the 31 CFR constructs assessed, the central themes and associated quotes guided by focus group input were best mapped to 4 CFR constructs: knowledge and beliefs about the intervention, access to knowledge and information, needs and resources of those served by the organization, and available resources. Here's an example of what one of these matrices looks like with the CFR construct, the construct definition, the theme, and the quotes associated with this theme. But more importantly, I really want to talk about the lessons learned from this project. So having incorporated Photovoice and the idea of mapping it with implementation science, we used the SHOWed method as that was traditional Photovoice methodology. And as we were using the SHOWed method, we found that it may not be the best way to facilitate conversations that can be linked more directly to CFR constructs, that it's really built for policy specifically, that's not getting at all of the potential levels that can be assessed using implementation science. And we found that mapping constructs at the beginning may increase researcher bias. So we then had to toy with the question of mapping constructs from the researcher's perspective. While it may increase the likelihood that they're discussed in the Photovoice group, but it may miss constructs that the group identifies that researchers may not have considered. So these were our major considerations that we had following this project to then question, how can we then improve upon this in using Photovoice and implementation science again? And I should say our findings were incredibly useful. It's not to say that this project was not a success, but rather we knew that we could do better to incorporate these 2 different methodologies. So I now want to talk about how we are improving upon what we learned from the Diversa Prep project. Does anyone have, before I get into this, does anyone have questions? Does anyone need a break?
That's a question.
Yeah.
I've not used Photovoice, but I'm very interested.
Yeah.
With traditional qualitative method, typically, like, I can go back, reanalyze data, use different, theoretical constructs to reanalyze data and come up with different findings and kind of slice and dice up a project. The ability to do that with Photovoice.
So I think that in similar to qualitative is that your output, you really are getting these transcripts of conversations that are occurring that is going to be almost exact as to what you'd have in an outcome of a focus group. So you have the difference being you have voted upon themes that have already been prioritized by those that are in the community. So although you have the entire transcript, which you could use traditional qualitative analysis to go through with all of these different mapping and find different themes each time, they have already told you what they believe to be the picture that is most important, and with that picture, what they believe to be the most important. So I think that the addition is really the prioritization that they provide and saying, this is what we as a group believe to be the most important. This is what we collectively are then saying, and we believe it's generalizable to the group that is participating in Photovoice here, right? So I think that you could then say, if it was okay with the participants after having gone, do you mind if we analyze this, full qualitative transcript of the entire focus group? And I'm sure you'd have different personal findings and different thematic findings, but your outcome is really at a group level of them presenting these to you. And so I think that that does differ a bit in terms of prioritization. But I think that very similar in that if you wanted to use the transcript to do full qualitative analysis, again, after the fact, you're not prohibited in doing so. But again, that was unique to the fact that we did these Zoom focus groups. So if you do it individually, everyone goes and takes the photos, you wouldn't have that focus group conversation. So I think it also would be depending on how you propose the project. Any other questions? Yeah.
And I was struck by the examples and the presentation quotes that there seemed to be some pushback against what ubiquitous promiscuity narrative, right? And so I'm kind of curious, thinking about how to identify something like that social level.
Mm-hmm. Right, and I think that it's talking about, if we're talking about implementation, CFR are constructs that are really trying to guide us to implementation that is going to be reaching the populations that we're trying to be reaching. So if you're understanding that CFR also requires context, so I think everything exists within context. So I think that even if it's not perfectly mapped, providing that context to then understand and say, okay, if people are feeling as though we are too much so digging in on this sexualization, how can we then back away from that so people are not feeling as though it's stigmatizing and trying to then continue this passing of knowledge? So I think that it would be more context than necessarily a specific CFR construct, but I think that that was also something that's big, right? We need context to then understand how to then implement something in a community that's going to respond to it well. So I think that that was critical context to understand. And that maybe if we're then going to be recruiting for another project, we're not going to put shirtless men on the flyer that we're going to be using to recruit. So then also making sure that anything that we do is not going to be furthering something that we found that the community wasn't reacting to well, or was not enjoying and was not responding to positively. Yeah.
Out of curiosity, how many didn't have access to a device?
None. So it was actually, because of our relationship with the community partner, no one reported not having access. And in the case that there was a person that didn't have access, the community partner had said that they could come in to the clinic themselves and utilize resources of the clinic. So whether that be an iPad or otherwise, but in the screener, 0 of the individuals that were approached reported not having access to a device. So that could speak to the generalizability, the fact that this clinic potentially is seeing clients that are not having cell phones or are with access to cell phones. So I think that, yeah, that's always something to be aware of too, is, are you reaching every single population? No, but the one that we did reach out to, we didn't have anyone that said it was prohibitive. And when we did a little bit more work there, we found that over 80% of the population, stably housed or unstably housed, was reporting having access to a phone that had capabilities to take pictures. this is a bit outdated, but we just wanted to do a little backtracking and say, like, is this something that has been looked into? So while we didn't do that study to find that number, it was existing literature that was there. Any other questions? Yeah. Yeah, so what I'm actually going to be, so not in this pilot project, but what I'm going to be talking about now is really what we then learned from this DiversaPrep project, how we then tried to improve upon incorporating CFR constructs and a Photovoice method. And then this is kind of a work in progress, so I don't have outcome pictures here. So happy to have all of your input in this as well, but really talking about this work in progress and how we changed this methods and these combination of methods from that initial implementation, and talking through our thought process of how we did that. So that's what I hope to present now. And if I don't answer your question, please raise your hand after the fact. Okay, so that's a perfect segue. So now what I want to talk about is how we're improving upon what we learned from that first project. And we had a lot of successes, but like I said, I think we recognize that the showed method question, or asking about this literal question and what do you see here, what can be done about this, didn't get at the actual theme that we were trying to capture, and I think actually confused people a bit in trying to understand how this related back to prep services. So what we see here makes you think much more literally, as opposed to being able to kind of conceptualize photo taking to then be able to talk about these prep services. So we then asked ourselves, how can we then incorporate implementation science language, or better replace these showed method questions with implementation-based guiding questions? And that's what we have worked towards doing. And so that's what I will be presenting today. We then also created, or are planning on creating, a two-pass coding system. So first applying the CFR constructs to our initial codes that we are going to be getting from the Photovoice sessions. And then this is actually something that is new for us, but we're excited to also see, and we're really going to be piggybacking off of work that has been done by Dr. Harkness and Dr. Lozano. So seeing the work that they've done in focus groups and applying the equitable implementation science framework to do the analysis, we're hoping to do that as well. And then the third thing that we really realized is, if we wanted facilitators of this Photovoice and implementation science project to be able to recognize themes that might come up that are in fact related to CFR constructs, we really needed to tailor the training of the team that was going to be acting as facilitators of these Photovoice projects. So in probing beyond showed, we needed to ask about actionable items, and a novel piece of training the team was to expand training so facilitators can recognize when CFR constructs were being brought up and react to them in the middle of those groups to further probe and discuss. So this is the next project. It's called Circuit IT, and the objectives of this project and the goal of this project is to explore and plan the groundwork needed for the future implementation of a one-stop shop prep program at a variety of CVS health locations, and to determine if the necessary resources are available for effective future implementation. So for this project, evaluation will occur at 3 levels. I will only be speaking about the CVS client level, which is the level at which we utilized Photovoice. So in mapping Photovoice to CFR constructs, we recognized, most importantly, we needed to identify the implementation setting, define the context and setting where this implementation will be taking place. In this case, we have CVS health locations, which includes CVS Navarro, Target pharmacies, and CVS pharmacies. We then identified constructs that we as researchers believed were relevant to the specific aims or had face validity to the research team. And using the health equity implementation framework, we then connected culturally relevant factors, participant interaction, and social context of the participants. So just a pause for this. As we are, doing this as research in progress, I wanted to hear a little bit about what people have used the health equity implementation framework for, and in what kind of projects this has been successful. Do we have? I know, Audrey, you have. We're using you as a citation for this, so thank you for that. Does anyone else have experience? I know Alyssa too, but I won't pick on you either. No? Thoughts on how this can be used? Okay, failure of a question, but at least it got us a pause in this, right? A little bit of a break of me just talking up here. Okay, so here we see the health equity implementation framework. And something that was striking to me was how similar much of the levels, like organizational levels, fit really well with the CFER constructs. And I think that's something that was obviously noticed by Dr. Harkness and Dr. Lozano, that it fits really well. And it seems like a logical next step in doing some of this qualitative analysis. And so this is something that have not incorporated but are excited to incorporate in this next iteration and this next Photovoice project. So mapping the questions to CFER and outcomes, and then doing a second pass to map to the health equity implementation framework, and using a similar process to Dr. Harkness' two-step qualitative analysis. And in this case, identifying those, inner organizational levels and the outer organizational levels, and really defining the local neighborhood versus each individual CVS location. So being clear in how we define each of these different structures and levels. So what we first did was met and viewed all CFER constructs and adapting these showed questions. Our first pass was to familiarize everyone on the team with CFER constructs. That meant reviewing all of CFER 2.0 constructs, then looking at the semi-structured interview guide with all of the constructs selected to brainstorm potential questions that fit the topic. That is, what would people need to see in this implementation of a one-stop shop prep program in a CVS location? So with the whole team, some of whom had a lot of experience in implementation science, some of whom had no experience in implementation science, really thinking through all of those questions, what could provide probing language that would be useful when we're asking people to go and take pictures of this concept in the community. And then something that was really important and I think has been built into implementation science is ensuring that we're refining the language to non-scientific audiences. This is also a lesson learned. Although barriers and facilitators are something that people think, oh, that's known by a lot. That was really confusing language in the first Photovoice project. And even after defining barrier and facilitator, then recognizing that people didn't really understand what you meant by that, and then asking them to take a picture of that was like, one, you already confused them with the lingo, and now you're asking them to take a picture of something that they're a bit confused about. So in this case, we spent more time ensuring that we were refining the language to a non-scientific audience, and we're fortunate enough to have lab members that don't have a scientific background and had no experience in CFER that really helped us iterate through this as a first pass of kind of breaking down some of the implementation science language. We then also developed multiple phrasings for parallel discussion points. So recognizing that asking the same question of what do you see here becomes a bit redundant. So coming up with kind of prompts of how, when we hear any sort of buzzwords, how can we come up with different phrases to ask for probing questions in a way that's going to be unique each time and potentially facilitate more conversation without overdrawing or trying to bring someone into a specific point. And then in this case, we also looked at consulting with either a community advisory board or a non-scientific audience to then confirm our phrasing and jargon. So this is an example of what it looked like when we were doing our mapping process. So here you have the entirety of the outer setting domain, each construct, that construct definition, the questions that were created by the research community, and then potential probing questions that could be asked for each of these constructs. And something that, again, I spoke about before, we realized that providing context was key in Photovoice. So in session one, in which we had previously just trained the trainer, we also recognized that we needed a bit more context for the individuals that were taking part in these Photovoice groups. So rather than just saying, hey, go out into the community and take these pictures, we needed to have a little bit of an understanding of where their baseline was prior to then getting these pictures that are going to then eventually impact the way in which this program is going to be suggested for implementation. So these questions are going to be brought up at session one to really get a feel for what people's baseline were. What are positives about existing CVS health programs? What are positives about existing PrEP programs? What are negatives about existing CVS health programs? what are negatives about existing PrEP programs, what changes should be made to existing PrEP programs if you're aware of existing PrEP programs, and could you describe what a CVS-based PrEP program should or should not look like? And do you think those in your community would have a preference between the CVS health entities, that is CVS, Target Pharmacies, and Navarro? And if so, why? And here, in creating themes for photographs, rather than asking simply about the barriers and facilitators to a PrEP service program, we wanted to probe and ask more about local conditions, local attitudes, and then ask specific questions that one can address at the personal level with their photos. So questions such as, what would need to occur for you to utilize a PrEP program at a local CVS pharmacy? What makes it difficult for you to access CVS, Navarro, or Target pharmacies? And why does this photo represent one of these reactions? And then we are going to provide participants with examples of how these can be captured as a way of going a little bit beyond what was done in our previous project to try to explain what local conditions mean and to then provide a little bit more context before we ask them to go out into their communities and take pictures. So here, for example, it's local conditions. And the photo doesn't have to be literal. So here we see in the first example, up top left, a photo can represent some personal, economic, environmental, political, or technological condition that might affect you if you were trying to get PrEP at your local CVS, Navarro, or Target pharmacy. And photos can represent something that makes it easier or more difficult, right, for one to reach a pharmacy. We're going to be doing the same in defining local attitudes. So really trying to probe what are some values or beliefs that your local community shares? And do you think that the values and beliefs that one of these CVS pharmacies promotes or embodies connect with the Latino community? And then really using Photovoice to dig into the preferences here. So the prioritization of preferences for choosing a pharmacy, what one liked about other health programs they had been a part of, for example, CVS vaccine programs, and how these can be then captured in a photo. So again, this is just the CFR guide that we use as the initial, and these are the hidden prompts that we then developed to help the facilitators as they are going through the Photovoice session too. So here, this is just one example, and it reads, if any picture or caption shows or alludes to the conditions or environment of a local CVS, you can prompt with questions such as, when Latinos go to CVS, Navarro, or Target, what about the store makes their experience more pleasurable? What aspects of CVS stores make the shopping experience more enjoyable for the Latino community? And how could CVS improve their reputation as sexual health providers for the Latino community? So this was done using the CFR 2.0 constructs and really trying to emphasize the community-focused answers and general consensus from the group, given that that is the level at which the outcomes will arise or will come as. And we did a mock run through, knowing that we were making quite a few changes to the showed method and knowing that these prompts were going to be novel and different. So we did a mock run through and collected data as part of a team practice where I acted as facilitator, Kyle, who was supposed to be presenting with me, acted as note taker, and the rest of the lab were group members who submitted photos and discussed. And in this, we also found categories to group the photos and asked if there were commonalities between the photos, and found that it was, things like hospitality, incentive, innovation, and engaging, as this photo was voted on as the photo that best represented a barrier facilitator. And in that, the group caption agreed upon after this discussion, warm welcome and generosity are important to engage and build community. And what we plan to do in the analysis is to code and theme the visual and narrative data, to map this qualitative data again to the CFR constructs, and then to evaluate the data through an equity lens using the Equitable implementation framework. We will combine the insights from CFR Photovoice and the Equitable implementation framework to get a holistic understanding of the findings that we have from the Photovoice activity and the Photovoice sessions. And then again, we plan to present the findings back to the community members who were a part of this for their validation and input, and with them to develop an action plan. So from the beginning, they will know that the goal is to let CVS know of their beliefs and desires as we move forward with a hypothetical implementation of a PrEP service program, but allow them to create an action plan to address the identified barriers and leverage those identified facilitators. And something that we found in the initial pilot or the diversity prep program was that training the team was something that we needed to focus on. So it originally focused on train the trainer, which is really, here's a slide deck of things that you need to give for a facilitator to understand. But we recognize now that we're incorporating Photovoice, CFR, and the Equitable Implementation Framework, those are three things that each facilitator really needs to become an expert in. So this is something where we then sat back and said, how can we ensure that we're giving the team adequate training so they feel comfortable in each of these three very distinct methods to then be able to make each participant feel as though they have adequate information to participate. So I was going to do a let's hear from you, but I have 5 minutes left, so I'm going to not do that. I apologize. And really just talk about the lessons learned from training. So we have recognized that we need a 2 facilitator format. We need a note taking and we need someone who's note taking and organizing the photographs that have been submitted by participants. And we need someone who's independently going to be acting as a discussion leader. We're going to be doing rapid analysis instead of thematic analysis that we did in the initial. And we recognized that we needed to develop best practices for leading focus groups, specifically Photovoice focus groups. And something that we're currently working on is standardizing note taking. So in that mock session, we actually asked people what their style was for note taking, what worked well, and how can we ensure that if we are going to do a rapid qualitative analysis, that our note taking is really going to facilitate truly rapid analysis of what's being done. So sharing strategies for note taking, sharing strategies for emphasizing things that have been said multiple times, and creating a standard. Also recognizing that the group develops consensus caption, and that is separate from the initial caption. So this is the same as what we did in the first. So we plan on training the facilitators to ensure that it's the group consensus and that group created caption that really will move forward to the initial pass. And what have we done in CFR to adapt this? So we did create hidden slides with group consensus of relevant CFR constructs. So that's something that we've never done before, right? Having these prompts that say, if you hear these buzzwords, if this is alluding to a local context, ask these questions. And then really redirect, asking each of the facilitators to really redirect back to a community-focused answer or a consensus-focused answer. And another adaptation, which is similar to before, is each photo will have an individually derived caption, again, developing themes in a group, and the group consensus and voting of most relevant photos and new captions for the CFR. Lessons learned from training in creating best practices. This is an example of some things that we will include in our best practices for facilitating a Photovoice focus group. And it's ensuring that we first ask participants if they had any issues with taking photos, if they learned anything in the process of taking photos that would be useful for future implementation of Photovoice projects. And that not everyone needs to agree on an opinion or caption. So really ensuring that our facilitators, although it is group consensus, ensure that not everyone needs to agree with everything that is said, and that people are being prompted and given time. So it's not just, I think this is with all focus groups. So it's not just one person really taking too much of the time there, and that really all voices are being elevated through this process. And also recognizing that even if the photos are recognized as the same topic and everyone's saying, oh, this is something that's structural, this is transportation, that each time this is seen, a different conversation might generate different outcomes and different themes and should still be discussed and prompted. So although it might seem redundant, to give each photograph its time and its time to shine and a distinct discussion to be able to occur for each of those. And to combine education or research sharing if prompt is unclear or photos do not match the topic. So recognizing that again, from our first project, that some people might not understand that this is asking about the implementation of a future prep program. If that's something that people were not able to conceptualize, figuring out how, without overtaking the conversation, a facilitator can prompt questions that might bring it back to be more related to the initial project at hand. So our overall conclusions, and again, this is still a work in progress, and I'm happy to hear loads and loads of feedback, is that we really have found Photovoice incorporated with CFIR to be very useful. And we hope to incorporate also a health equity framework. And we think that this will add another layer that will only positively impact the outcomes that we're going to be getting from the next project. And that we should consider systems level components in the intervention, as well as individual or organizational level components. And again, the whole purpose of Photovoice is to ensure that there's always this emphasis on the community driving the constructs, not the researchers driving the constructs. And that Photovoice can help participants to focus on the themes and constructs that they identify, and that hopefully through this addition of these prompts, we can then also further focus on the themes or constructs and make it a little bit more mappable at the end. So questions that we asked ourselves as we were doing this adaptation was, from that first project to the second, in future projects, how can we better incorporate Photovoice and CFIR? How can we ensure the CFIR language is understandable to those in the community? How can we incentivize for-profit companies to utilize IS findings for program development? So that is, how can we work with this really unique partnership and ensure that the community findings are actually going to lead to something that is going to be implementable? And then how can we further ensure that the sustainability of findings and publications promote the adoption of something that would then benefit those that participated in this? So I think my time has been up for over a minute. Sorry that I ignored your sign, but that is all I have here. And I think there's time for questions. Okay. Sorry, I spoke a lot and really fast, so I apologize for everyone having to listen to all of that. I don't like hearing my voice after about 15 minutes, so this was a lot for me too. Questions, comments, concerns? Yeah. So unfortunately, that was part of the original plan, but because it happened in the absolute midst of COVID, we had to adapt everything to be Zoom based. So the exhibition that we did was a PowerPoint presentation of all of the photos and their associated captions, but it wasn't a physical exhibition just due to the limitations of COVID. Any other questions? Yeah.
Assumption is that you work with like the application, but had any trouble with like the uploading? It takes some time to do that.
Yeah. And I think REDCap is, I mean, even for me as someone that I consider myself young, is difficult, right? Can be very difficult. So we do provide links, and in this next iteration, it's actually going to be uploaded at the start of the session with the help of the facilitator. So that's going to actually really benefit. In that case, I think because the people we had to adapt to Zoom, there might have just been a little bit more technology literacy among those that participated. So we didn't run into issues, but I imagine if it was not a Zoom participation, like that was a part of the requirements because of COVID, I'm sure we would have run into more issues with that upload and had to deal and like think our way through how can we lower the barrier to entry for people that haven't used this technology before. But I think it was a bit of a unique scenario just because of the adaptation that we had to make. But we hope to not have to deal with that now that we have thought about that and have taken that barrier away in the next iteration. But great question, thank you. Yeah. Sorry, I wasn't looking.
I'm wondering how this is written. So, like as a paper and showing your findings, it seems like there's a lot to unpack, and also the inclusion of pictures.
It was one of the longest submissions of a manuscript I've ever experienced, and it's not one that's like my favorite to edit because it is lengthy, but we actually just had this and it should be coming out really any day now. So the initial findings from PLOS One, this feels like a really shameless plug, but it should be coming out really any day now. And I'm happy as soon as it's out, if it's okay with the organizers, I'll go ahead and share that and you can see it. But it is quite lengthy. I mean, it's one because you want to ensure that you are as close to what those captions said, and because you are including pictures, I mean, it's one of the longest manuscripts I've submitted, that's for sure.
Did you organize it by CFER constructs or was it?
The results
domains?
are organized both by theme and CFER constructs. So both.
And did you receive any reviewer pushback in terms of how long it was, or was it?
The journal we
Awesome.
submitted to didn't have, I mean, I think that anyone that read it, and because we asked other people to be editors, they were like, that's a lot to be editing. But we didn't have so much pushback that it wasn't possible to move forward. I think something that was really great feedback that we received and what is helping us want to move forward with more actionable items was, this is great in identifying barriers and facilitators, but what next? What more are you going to do with this? And I think that was a great question to have, to then say, okay, well, it's great to identify barriers and facilitators and to take this context. We do need to be thinking bigger in terms of, it's not enough to just keep presenting, we found barriers and facilitators, because that's almost, everyone knows there's barriers, right? So I think that was kind of something that seems simple, but was a great reminder that we can push to do more, even though it might facilitate just coming up with more facilitators and barriers, that we can also then prompt more actionable items and then return that back to the community through this like second session of the group and asking them, what do you want to see change? How can we then incorporate our community partners or our partner in this to then see that actually happen? And how can we then also talk about sustainability as opposed to just identifying these barriers?
So having like a future orientation.
Absolutely, future orientation, and then being able to say, how can we then feed this into those that are actually going to be able to potentially implement that? What are the issues there? And then how can we actually move this forward? So just thinking a little bit beyond how we had initially. Yeah. Any other questions?
Something that Latino reform is related to the Latino cultural value collectivism. Like we were actually we wanted to study Latino salute, one structure of the program, but the participants wanted to talk about service that is for the whole community.
Oh, absolutely.
That is specific. So that is how what we ended up having. We wanted to have one specific,
Right.
one structure for program, but
And they wanted to approve all prep programs, which is actually, I mean, which was great. It started specific, and it really, I wish I could have focused more upon those findings, because that really was interesting, that it was this huge community focused finding. And so they said, okay, we hear what you're saying about this specific, but this one's been successful for us. Here are ones that have had issues that we'd actually like to see improved upon, so more people can have access to prep, which was, because of the initial prompt, that was not something you were thinking about studying, but that's also a great part of Photovoice, right? They brought about and they really drove that conversation to say, while we have one successful, we see 5 that are not as successful. So what collectively could be done to improve upon those programs? So it ended up being more of a guide of general prep program implementation that could benefit not just Latino Salud, but other prep service programs in South Florida.
How we incorporate the social network to facilitate engagement with the youth studies.
Any other questions, comments, jokes?
I just want to make comment. I'm so proud.
Thank you. Making me blush. Sit down.
Thank you so much, Dr. Johnson, for that informative presentation. We're going to take a break and then come back at 2:30.